So there are two tests that you can use to assess fall risk in a patient. Usually it's in your older population, but it can also be used for anyone who's maybe had surgery in their knee or ankle, hip, neurological disorders like Parkinson's, brain injury, stroke, anyone who could possess a risk of falling outside of the clinic, in their home, in the community. So the Berg will test just your balance. It uses 14 functional tasks, which include sit to stand, seeing if you can do that with no hands or without any support on the chair. When in standing, if you can stand with your feet together, tandem, eyes open, eyes closed, 360 turn without falling or without a shuffled gait, reaching to the floor to grab something, stepping 1 foot after the other, alternating onto a step with 1 foot at a time, eyes closed, eyes open in the standing balance, and also if you can sit with your back off of the chair. And that test it's from 0 to 56, 56 being you're fully functional, and the lower you are, the higher of a fall risk you are. And then the Tinetti will test balance, kind of similar to the Berg, the standing balance with the feet together, eyes open, eyes closed, Sharp and Romberg with standing tandem, but it also assesses your gait. So with the Tinetti, you'll start with the patient in the chair, and you'll see how they're able to sit with their back off of the chair, hopefully, or if they need the back. Then you'll watch them stand, see if they're able to do it with no hands or if they need hand support. And then once they're standing, you assess their balance once they're up off of the chair, if they can just balance on their own. Then the difference between the Berg is you're applying force, nudging them to see if they can catch their balance, if they fall over, if they sway a little bit, and that'll determine the score that you give them. For the balance, it goes up to 16 points, 16 being more functional, lower than 16, a higher fall risk. And then the gait portion of the Tinetti is what's different from the Berg, and that portion can go up to 12 points. You'll measure out 15 feet. You'll tell your patient you want them to walk as fast and as safely as they can. And with this test, they are able to use the assistive device that they normally use, like a cane or a walker, but you want to note that when you're testing or when you're documenting for the test. And they'll walk 15 feet all the way down, and then they'll turn, come back to the chair and sit. And while they're walking, you're assessing all portions of their gait. So if they have a shuffled gait, if they lose their balance, if they're able to start quickly when you tell them to, their stride length, if they're swaying, if they lose their balance when they turn, if they deviate the path, you want them to try to keep a straight path, if they deviate from the path. So all those you'll note, and you'll score 0 to 12. And then you add that together, and that will give you their full score for their fall risk.